Welcome to our smoke-free campus. Cigarettes claim the life of 442,000 people every year. Toxins in cigarette smoke can weaken the body's immune system and damage cells and DNA. The combination of a weakened immune system and damaged DNA cells allows cancer and tumors to form anywhere in the body. 9 out of 10 people diagnosed with lung cancer are because of cigarette smoke. Smoking causes heart disease and stroke. Coronary heart disease is one of the most common heart diseases associated with smoking. Smoking accounts for 9 out of 10 deaths of people with COPD and is the third killer in the U.S. Quitting smoking causes the body to go through a series of positive changes, and the effects of smoking are reversible. After 20 minutes of not having a cigarette, your heart rate decreases. 12 hours of not smoking decreases carbon monoxide levels back to a normal level. After 2 weeks to 3 months of not smoking, your risk of heart attacks decreases and your lung function gets better. After 1 to 9 months, coughing and shortness of breath reduces. After 1 year of quitting smoking, your risk of heart disease decreases to half of a smoker's risk. After 5, 10, and 15 years of quitting smoking, the risk of cancer, heart disease, and stroke decreases. There are many positive impacts on overall wellness of a smoke-free work environment. Work environments have increased productivity and decreased absences. Medical costs associated with tobacco use decreases, and people that do smoke cigarettes smoke less. Exposure to secondhand smoke in a smoke-free environment is non-existent. The success rate of quitting smoking is higher in a smoke-free environment. Positive role models are important in the workplace. Negativity can be contagious, but so can positive role modeling and positive lifestyle habits. Those that are trying to quit smoking won't have temptation in and around the workplace. Employees can mentor and give positive reinforcement to those that are trying to quit smoking or change other unhealthy habits. A smoke-free environment encourages positive lifestyle habits. The behavior change theory happens in 6 changes and can be used to determine if a person is ready to quit smoking. The pre-contemplative stage, where people are unaware of the health risk in relation to their behavior, or they may feel as though they are beyond help. During the contemplation stage, people are aware of the health risk associated with their behaviors and consider changing those behaviors. During the preparation stage, people make goals to change behaviors. The action stage is where people are making changes in their behaviors and exhibiting new behaviors. The maintenance stage is when people continue exhibiting positive changes and behaviors. The termination stage is where people continue to the maintenance stage without temptation or relapse of behaviors. One way to motivate during the pre-contemplative stage is to make a list of healthy behaviors you already have. One way to motivate during the contemplation stage is to evaluate the behaviors and health practices that are negative or harmful. A way to motivate yourself during the preparation stage is by making your goals realistic and obtainable. It may help to make goals public and share them with people that will support you. During the action stage, a way to motivate is to write a contract with your goals and include strategies for setbacks and rewards for incentives. Continue to use previous motivators during the maintenance stage that were used in previous stages. A way to stay on track during the termination stage is to know the signs of relapse. There are many over-the-counter and prescription aids to help people quit smoking. Nicotine gum is gum containing 2 to 4 milligrams of nicotine that allows people to quit smoking. Nicotine gum has a 40% success rate with a doctor's supervision and allows people to gradually decrease nicotine dependency. Transdermal patches reduce cravings and are available in 2 versions. One version is a step-down type of patch containing nicotine, and the amount in each patch gradually decreases over the course of many weeks. The single-dose version contains the same amount of nicotine in each patch. The transdermal patch's effectiveness rises about 40% with the guidance of a doctor that can prescribe a quit-smoking drug called mecamylamine. Prescription Nicotrol inhalers are also available as an alternative, which helps decrease nicotine cravings.